Health Equity 101, Video 4, What Health Protection Can Do to Support Health Equity. This is the fourth video in our series about health equity and environmental health. The first three videos focused on how health equity and the social determinants of health arise across different practice settings. This video is about how all levels of leadership can begin to integrate an equity lens within health protection or environmental health departments. Directors, CEOs, and other senior-level leaders can incorporate health equity into policies, programs, and organizational culture. Managers can support staff to apply an equity lens in practice. We've seen from the previous videos that health equity is a broad goal. There are multiple social determinants that can impact outcomes related to environmental health. Maybe you don't feel that social issues are part of your mandate, but health equity relates to all aspects of public health. Environmental health is tasked with enforcing specific legislation, but this work can still be compatible with advocacy and health promotion. Health equity is a big issue that seems to apply everywhere. How do you even begin to incorporate it into existing programs? Maybe health equity is new to you and your staff. What do you know about vulnerable groups in your region? Do staff have the necessary knowledge and skills to respond? Resources are always scarce and people are busy. How can you identify effective interventions or develop evaluation metrics? We interviewed environmental public health leaders from across Canada to find ways to break down some of these barriers. Keep watching to learn about 5 strategies to facilitate action toward health equity. First, set a clear vision. It's helpful to articulate what health equity means to your organization. Then you can identify different activities that will help move you toward that vision. Environmental health can work downstream by finding ways to work more effectively with clients who face barriers. You can also work upstream to support changes in society or to help the public health system work better for everyone. A vision can help you identify how and where to act and let staff know that health equity is a priority. Second, this is an opportunity to look for ways to apply an equity lens to the health protection mandate. Policy frameworks can be leveraged to support your efforts to achieve health equity. Did you know that the BC Ministry of Health includes equity in its guiding framework for public health? Some health authorities have incorporated health equity into service plans. You can also look for natural partnerships with those working on cultural safety, diversity, and inclusion. Remember that health equity is not an activity or a program. It's a way of approaching what you already do. EHOs interact directly with communities, so they are in a good position to know and respond to core local issues. Consider providing training and guidelines to support this way of working. This will give EHOs more clarity about how they can factor equity considerations into their discretionary decision-making. Also, if staff have more opportunities to collaborate, they can find creative solutions to larger community issues. Third, embrace the complexity and uncertainty. Dealing with the social determinants of health can be a little messy because there are no clear rules. It's important to know that this is okay. It's a normal part of the process. Leaders can support staff who advocate on behalf of operators or communities. Consider recognizing time spent on health equity issues in performance evaluations. This work can be hard to measure, so encourage EHOs to keep notes about the equity-related issues they encounter, including how they respond, challenges faced, and any outcomes they witness. Then use this information to identify vulnerable populations or unintended consequences of policies and programs. Fourth, you may need to build resources to better apply an equity lens in your organization. It takes time, knowledge, skills, and practical tools. In the short term, you may be able to offer some health equity training during staff meetings. Program assessment tools can help identify inequities related to program design and delivery, plan interventions, and measure effectiveness. The BCCDC Equity and EPH Clearinghouse is a great place to start. Finally, to really become a health equity champion, you need to collaborate, be a leader, and keep talking. Public health can't take on this issue alone. Everyone has a role, but strong leadership is essential to inspire staff to take action. Take advantage of EHO's existing networks and find ways to build on and share those connections. Remember, applying an equity lens doesn't mean taking responsibility to fix every problem, but it does mean trying to mobilize services wherever possible. Frontline staff need to know who else is out there, what they do, and how to reach them. It can be helpful to have a designated health equity ambassador or liaison to share information and keep the conversation going at the frontline level. To recap, these are 5 ways to start putting equity on the agenda in your organization. Articulate your vision for health equity. Work with the mandate you have and leverage existing policies. Embrace ambiguity and complexity. Gradually and creatively build your resource base. Collaborate, lead, and communicate your way to being a health equity champion. This is a new way of looking at practice, so it will be an ongoing process of learning and reflection, changing attitudes, reframing roles, and evaluating program delivery. Watch the next video for ideas on what individual practitioners can do to support health equity.